Hi guys, welcome back to Nurse Katherine here. Welcome back to today's video. In today's video, we are going to be doing dosage calculations together. This is oral specific dosage calculations. Tomorrow's video will be IV specific dosage calculations. I will be screen sharing my screen with you all so you can see the math as I go through it and you can see it explained. Make sure you stay for the last question, or at least watch the last question, because that is the hardest question on here. There are only 3 questions and there are a few conversions in the very beginning that you do need to know as a nurse, as a nursing student, or even for your NCLEX exam. So I hope you all enjoy this video and learn something from it, and if you have any comments or questions, just comment below. Okay, so here we are. We are going to start with our conversions first up here, and then we are going to move down to our calculations. And make sure you do stay and watch for the third calculation, because this one is going to be the hardest one that we are doing today. So before you even do calculations, you must know conversions. So I am quickly just going to go through these. Let's see, let's use yellow here. 1 ounce is 30 milliliters, or 30 milliliters equals 1 ounce. And that is important to know for your medications that come in liquid forms. Let's move on to number 2, and this is also important because medications come in grams and milligrams and even micrograms. So 1 gram equals 1,000 milligrams. Number 3 is also extremely important because a lot of medications are weight-based medications, and in the science field and in nursing, everything is dependent off of kilograms and not pounds. So you must convert pounds to kilograms, and 1 pound equals 2.2 kilograms. And lastly, another conversion of micrograms and milligrams. 1 milligram equals 1,000 micrograms. Okay, so now we are going to go into our calculations, and first we are going to do number 1, of course. So the doctor has prescribed your patient the following medication: 550 milligrams of Keppra PO BID. You have liquid Keppra available. The label on the bottle states 1 milliliter equals 100 milligrams. Your patient weighs 150 pounds. What is the total amount in milliliters that this patient will receive in 24 hours? Well, first you're going to start with what the dose is, and that is 550 milligrams of Keppra. You know it'll be taking orally, that's PO, and BID. You must know your abbreviations in nursing and when it comes to NCLEX. So BID means 2 times daily. Excuse my writing. And you have liquid Keppra available. Perfect. The label on the bottle states 1 milliliter per 100 milligrams. So you want to get the amount in milliliters that this patient will have in 24 hours. So you know 1 milliliter equals 100 milligrams. So how many times can 100 go into 500? Well, that's easy. That is 5.5 times. That 100 can go into 500 for your dose. And that 1 milliliter equals 100 milligrams. So that's 5.5 milliliters. But this is a BID, and it is asking you the amount they will receive in 24 hours. So you need to times this by 2 because it's a 2 times a day medication. So you are left with 11 milliliters in 24 hours. So your answer is 11 milliliters. Now, I did try to trick you with the weight right here. Some people do get tricked up with that, and they see a weight and they automatically think that they need to use the weight. I tried to trick you, and sometimes NCLEX might do this too, that they will put in extra information that you do not even need to know. So you can just cross that out and you don't even have to look at it. Okay, next we are going on to number 2. This says your patient is to take prednisone for the next week. They are to take 1 pill a day in the morning. They are to taper their dose by 2.5 milligrams every other day. If they start their first day at 10 milligrams, how many milligrams will they be taking on day 4? So for questions like this, I always find it easiest to just write out the entire week. So I am just going to write out the days. 1, 2, 3, 4, 5, 6, and 7. The first day they are starting at 10 milligrams. And they are tapering it down, you can see, by 2.5 every other day. The big one is you want to know how much they will be taking on day 4. So 10 milligrams, and they are going to do the same thing on day 2. So they take 10, don't do anything. Then they taper it down by 2.5. So then they go down by 2.5 on this day. And then on day 4, you can see they won't do anything again. Then on this day, they would go down, don't do anything, and then go down again. So what is that day 4? Well, you just need to do 10 minus 2.5, which brings you to 7.5 milligrams. So that is your answer, 7.5 milligrams they will be taking on day 4. All right, guys, that is it for today's video. Thank you for tuning in and watching. Don't forget about the live NCLEX review I have going on. That was actually like 2 hours ago. It was at 4 o'clock today. Every Monday, I am going to be doing a live NCLEX review, actually at 4:30 on my Instagram account. So make sure you do tune into that and check that out for NCLEX prep ideas and advice and questions. And of course, subscribe to my channel so you know when new videos are coming out. Currently, a new video is coming out every single day. Tomorrow's video is on IV calculations, dosage calculations, so stay tuned for that. Other than that, that is it for this video today. Thank you for watching, thank you for tuning in, and I will see you tomorrow.